Welcome back to Everyday Iowa. September is Prostate Cancer Awareness Month, which is a time to remind men in our lives about the importance of staying proactive when it comes to health. Prostate cancer, one of the most common cancers in men, but the good news is this: it's also one of the most treatable. And today, joining me, Dr. Matthew Ferroni from Mercy Urology Clinic to talk about the importance of early detection. Doctor, thanks for making time for us this morning.
Thanks, Justin. My pleasure.
This is, dare I say, a little bit of a sensitive subject because as Iowa men, we're stubborn. We don't like to go to the doctor unless we really have to. But you're here to tell us there is good reason to stay ahead of this. Let's start with that.
Absolutely. So, yeah, you hit it right on the head. You know, culturally, men stay away from doctors, and especially here in the Iowa Midwest, lots of farmers, a lot of the attitude of, if I'm not sick, if nothing's wrong, then I'm healthy. But the most important part about screening for cancers is finding those cancers before they cause any types of symptoms. And prostate cancer is no different. If we find prostate cancer as early as possible, we have the best opportunity to treat it and often to cure it.
And then obviously this is, you know, you're talking about a sensitive area, both physically and literally as well. A lot of guys don't want to talk about that.
Yep.
So how do you overcome that kind of the stigma or the fear of, I don't want anybody to know about this?
Yeah, no, and I think what you're getting at too is a lot of men have fear about the prostate exam, and that keeps men away from the doctor a lot. In urology, we have these sensitive conversations all the time with guys, and I think there's just an importance to just kind of keeping it on their level, not being super medical about it, but men understanding the importance that prostate cancer ultimately affects 1 in 8 men in their lifetime. And men that we find it, again, as early as possible, these are the men that don't have to worry about it, don't have to worry about dying of prostate cancer, can see their kids grow up, can see their grandkids grow up. And that's a really important message to men, that it's not an ignorance is bliss kind of situation. Getting screened, getting tested early really makes all the difference.
You mentioned the prostate exam. There's some tests as well that you guys offer. Kind of tell me a little bit about those.
Yeah, and that's the reality is 95% of prostate cancer that we find is found by a simple blood test called a PSA, or prostate-specific antigen. So the prostate exam that most men are so afraid of really only finds about 5% of cancer when the blood test doesn't. So if all men are doing is getting the blood test for prostate cancer screening, that's at least a really good first start to make sure that they're healthy and there's nothing really to worry about.
And worrying about it healthy, let's talk about symptoms. Sometimes there are none, correct?
Most of the time there are none. So it's an important distinction. As men get older, the prostate really becomes more of a liability. So what the prostate does is it's just an organ that helps with fertility. Once those years are over, the only thing the prostate really does is potentially harbor cancer and potentially enlarge and cause urinary symptoms. And I think that when men start to have these urinary symptoms from an enlarged prostate, their first concern is this could be cancer. But the reality is prostate cancer usually doesn't cause symptoms unless it's very advanced.
So we're talking about prevention, we're talking about tests. Talk a little bit about treatment, because we mentioned on the onset, this is a treatable cancer if you do your homework and do the testing first to see if one of those, I'm the carrier or something like that.
100%. And it's important to remember who should get tested too, right? So there is a little bit of discrepancy with guidelines in terms of when we start screening. We endorse the National Comprehensive Cancer Network guidelines, which basically states for men with a family history of prostate cancer or African-American men to start screening at age 40, again, with that simple blood test. 45 for men with no family history, and keep screening up until a man has a guarded 10-year life expectancy. So that's usually around 75 or so. But you're right, if we find men, even in their 40s and 50s, with prostate cancer, most of the time it's not as aggressive as men in their 50s or 60s, and being able to do treatment like surgery or radiation generally has less of an impact on their quality of life for the rest of their life if we can find it early when that cancer is confined to the prostate.
If somebody has a history of cancer, whether it be prostate or bladder, does that raise a red flag at all and say, all right, maybe we should get ahead of this?
Yeah, absolutely. you know, everybody always thinks about family history of that specific cancer, but the reality is there's a lot of crossover. So for prostate, there's crossover even with breast cancer, with ovarian cancer. So the women in men's lives, you know, mothers, grandmothers that have those types of cancers actually does raise the risk of prostate cancer, not just prostate cancer itself with father, brothers, uncles. Colon cancer is another big one too. So it's real important to understand your family history and to be able to tell your doctor what that history is so we can map out what specific cancers men could be at risk for. And prostate is a big one. 1 in 8 men in their lifetime will get prostate cancer. And again, finding it early is the most critical.
And it is, as we mentioned, Prostate Cancer Awareness Month. Now would be a great time. Make the phone call. There's the information to get screened, get a test. Go talk to Dr. Matt. He's a great, I mean, he's easy to talk to, as you just noticed in the last 5.5 minutes. Doctor, I know you're a very busy guy. Thank you for making time for us this morning.
Justin.
And we want to send a ton of people over your way because, again, ounce of prevention, pound to cure. It's so true in a case like this.
Absolutely.
There you go.
Thanks for having me.
Come back and visit sometime. You know how to put the mic on.
Anytime.
You can host
Give me
next
a call.
time. You
Sounds
stay
great.
right there and you